This is Holistic Psychology with Dr. Michael Murphy. Dr. Murphy is a licensed psychologist who has helped individuals understand the human mind and behavior since 1985. Throughout his distinguished career, he has worked in community mental health, correctional psychology, and behavioral health leadership, giving him a unique perspective on both the challenges and the resilience of the human experience. In addition to his clinical work, Dr. Murphy is an accomplished author of Opiate Odyssey and contributed to multi-million seller Chicken Soup for the Soul. He is also a poet and philosopher whose writings have explored the intersection of psychology, personal growth, and the human spirit. Please welcome Dr. Michael Murphy.
What is mental illness? Do medications truly heal? Today, we enter one of the modern medicine's most controversial areas, using psychiatric medications to treat mental illness. Whether understood as biological, psychological, social, or a combination of all three, we'll examine prescribing thresholds to the use of multiple medications and whether psychotherapy, family support, or other interventions may be equally or more effective. Welcome to Holistic Psychology with Dr. Michael Murphy. I'm Dr. Gloria Warren. This program is presented solely for educational and informational purposes. Nothing discussed here constitutes medical, psychological, psychiatric, or legal advice, or creates professional relationships. So now, to lead the topic of today, mental health, illness, and psychiatric medication, treatment, controversy, and choice, the voice, the vision, and the man behind Holistic Psychology with Dr. Michael Murphy, Dr. Michael Murphy and his guest, Dr. Ofak Akhter. It's Ofak Akhter. I'll get that right, Doctor. Give me a chance here.
No worries. No worries.
Welcome, fellas. Good to see you.
It's great to be with you today again, Dr. Warren. I really appreciate the opportunity to talk about this very important subject today that is such a powerful issue. Now in the United States and around the world, the utility of psychiatric medications, what they mean, when they're appropriate, when they may not be appropriate. There's lots of different opinions about this, and we have a very deeply established authority here today with us, Dr. Ofak Akhter, who will be talking with us extensively about some of the complexities and subtleties of psychiatric medication that have come out of his vast experience in the field over many years. Dr. Akhter and I worked together at a psychiatric hospital in Massachusetts in the United States for a number of years, and I got the opportunity to share his wisdom and his skill and see just how perceptive he was and is with regard to really understanding the nature of mental illness and its subtlety and complexity and the influence of psychopharmacology in that area. So we're going to be getting deep into this issue today and really look forward to having a fun conversation.
Dr. Akhter, could you please give us some of your credential background for the audience?
Thank you, Dr. Warren and Dr. Murphy. My name is Ofak Akhter. I was born in a small village in India, and I did my bachelor's of medicine in India. Then I moved to Ireland, and I did my post-graduation in a membership from England. I did get my training in Ireland, and then after that, I moved to United States and I got a position in Harvard Medical School. There, I got some training with required by the board, and also I taught Harvard Medical School for 14 years. I practiced medicine in different fields, psychiatry, addiction, and combination of inpatient, outpatient, and other modalities. Currently, I'm working in an inpatient facility and advising a lot of people with outpatient and inpatient services, training nurse practitioners, nurses, and other ancillary providers.
Very, very impressive, of course. Let's move on to our first topic of today. What is mental illness? Before we can evaluate psychiatric medication, we must define the condition it is intended to treat. Dr. Murphy, what is your legal definition of mental illness?
So as a forensic psychologist, I can take a shot at that one. it- Mental illness, as legally defined, is a disorder of thought or emotion, the active symptoms of which are so severe that they interfere with the individual's ability to manage the daily affairs of life. So that sounds like kind of an obscure mouthful, but really it just means that someone suffers active symptoms like hallucinations or extreme depression, such that their ability to even do normal everyday tasks like fix a meal or get a part-time job or uh, maintain the cleanliness of their home is just too complicated for them to complete adequately. So it's important to keep in mind that a mental illness as legally defined forensically, is quite high. So it really means that you have a mental illness such as schizophrenia, what we used to call manic depression, now called bipolar disorder 1 and 2, and that the symptoms of that illness are really significantly impairing the person's ability to function.
Well,
So
thank you so much.
that's the legal definition of mental illness, and it
Yeah.
actually is quite high. So, we tend to throw the term around a lot, and we
Mm.
think, oh, gee, I have this illness, I have that illness. And so one of the things we'll be talking about here today is, how diagnosis happens and what actually qualifies and seems to make sense in terms of our treatment of those diagnoses.
Well, that'll be a good thing for the audience to hear, especially that. So, Doctor, do you have a specific like medical perspective on the definition of mental illness?
Basically, we are a little more relaxed, not like the legal definition of
Okay.
Dr. Murphy. So I take it as when an individual's thoughts and feelings and emotions affects their day-to-day living and they come for help, we are willing to help them with whatever way we can, whether it is medication or talk therapy or group therapy or psychosocial intervention, whatever we can do, we do. So our bar is a little lower than the legal bar.
So you can help a lot of people in your situation. I love that idea. So I know a person when they experience sadness without having major depressive disorder or something like that. A person may experience fear without having anxiety disorder, grief, anger, sleeplessness, emotional distress, may be painful without automatically representing a medical disease. So you definitely come in handy, that's for sure. Necessity
Yeah.
in society today. So, Dr. Akhter, where is the boundary between normal human reaction and a psychiatric disorder?
It's a very loaded question. But this this is a very complex question because what is normal? So it's different for different people, different threshold for different society, different threshold for different cultural context or socioeconomic background. So for a for an impoverished man in India, he has no concept of being depressed or he has no time to be depressed. He's so ingrained in making his day-to-day living. But on the contrary, in the United States is a prosperous society. We have a different expectation how we feel or how we experience. So the threshold is different for different society and different socioeconomic group.
So if I
Yeah.
could break in, it really is, that's a great observation. And we've seen the, uh, in my career, which began back in the 1970s or so, I mean, I can remember uh, that the rates of mental illness were extremely low. It was rather unusual to find a person who was legitimately suffering from a major mental illness in the United States. The percentage or rate of mental illness, diagnosable mental illness, was extremely low in the general population who you encountered in life. For example, I was in school, I'm a boomer guy. I went to huge schools with lots of students, and no one who I knew was actually diagnosed with a mental illness at that time. But things changed over time. And so as years went by, um, it seems that circumstances changed, as Dr. Akhtar is talking about, with regard to how people experienced themselves and their world and the stresses that they were under, and the way that human service systems sought to address and care for patients changed, such that the rate of mental illness became much, much, much higher. And we'll talk about that, that
Right,
change over the course of this conversation.
right. Dr. Akhtar, must a diagnosed mental illness always be documented before prescribing medication? Or if it's a temporary situation with an individual with symptoms or non-psychotic conditions, does that need to be documented as well?
Whenever you have a patient-doctor relationship, we are required to document whatever we do. So in any patient-doctor encounter, we make a presumptive or a working diagnosis. It may be far from the truth, but in order for us to treat somebody, we have to have a presumptive diagnosis. And there are
Right.
other things involved, the payments, the insurance, and all those legal requirements. But as Dr. Murphy was explaining, that the threshold of mental illness or the incidence of mental illness, it has changed. Yes, the society has progressed. The stigma has been removed. Every generation, we have less and less stigma about mental illness. If you remember, probably not too long ago, in 50s and 60s, if somebody had breast cancer, they will go far away, won't tell anybody, and get treatment and come back and won't speak about it. Those days were there too. And similar way, if somebody had mental illness, depression, anxiety, or psychosis or bipolar, they will quietly get treatment and would not discuss with you. So
Yeah.
now people openly discuss about it. So more acceptance by the society, more prosperous society being more prosperous, and access to care. All these factors together has increased the incidence of mental illness. And I think this is the last branch of medicine which came to light. Before, we had full control, or we had good understanding of physical illness,
Mhm.
diabetes, hypertension, coronary artery disease, or whatever it is, right? But mental illness, we really didn't know, and we don't know much about. But we are work in progress.
Right. Yeah, in the US, the 2025 rates were 20.6% of adults. That was 54.6 million people. Serious was 6.9%, 18.2. I'm glad that people are actually becoming more open. We are getting close here, so we are going to be taking a commercial break. Today, Dr. Murphy and Dr. Akhtar are helping us investigate controversy surrounding psychiatric medications, treatments for mental illness, and we'll now consider what psychiatric medications actually do right after the commercial. Stay right there. You won't want to miss this. We'll be right back.
Mike Zorek, a three-time California state champion in Greco-Roman wrestling at 114 pounds. Mike, blind since birth, was born in Hartford, Connecticut. He was a 6-time national placer, including 2 seconds, 2 thirds, and 2 fourths. He also won the Veterans Folk Style Wrestling twice at 152 pounds. In all these tournaments, he was the only blind competitor. Nancy Zorick, a creative spirit whose talents have taken her to the stage and into galleries and exhibitions in several states. Her father, a commercial artist who shared his instruments with his daughter and helped her fine-tune her natural abilities, influenced her decision to follow in his footsteps. Ms. Zorick has enjoyed a fruitful career doing what she loves. Listen Saturday mornings at 12 Eastern for the Nancy and Mike Show for heartwarming stories and interesting talk.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of The Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on The Caring Generation and PamelaDWilson.com.
Welcome back to Holistic Psychology with Dr. Murphy and our guest today, Dr. Akhtar. Now let's look at how psychiatric medications work and how effective they are. Dr. Akhtar, people often hear that psychiatric medications correct a chemical imbalance. Is that explanation scientifically accurate, or is it actually a process more complicated than that?
Let me tell you something. We don't know much about the brain. Forget about the mind.
Mm-hmm.
So the psychiatry is a study of mind. So we really don't know much about it.
Right.
Whatever hypothesis there are indirect evidence and a presumption and assumption, and that's the way most of the chemistry is described and we were taught, but really we don't know much about it. For example, they say that overactivity of dopamine causes psychosis, and if you give dopamine blocker, the psychosis gets better. But not all dopamine blockers are antipsychotic. And a recent study came in England, and the conclusion was that serotonin has nothing to do with depression. So really, we don't know much about how the medication works. But in serious mental illnesses like schizophrenia, bipolar illness, medication do work.
Right.
And if you remember, when chlorpromazine came in 70s, a lot of asylums were empty because a lot of people were treated with medication and stayed home. So medication do work. And what I believe at this point, that if you remember the classification you used to do in past, that a psychotic illness and a neurotic illness, although it is a derogatory term now, but people with psychotic illnesses, they do get better. With other, you can so and so neurotic illnesses like depression or anxiety and all that. The two school of thought. One school of thought is a temporary, and it will pass. You don't have to medicate. Some people think that no, you need to treat. I'm in between, that some of the depression or anxiety needs to be treated. But I'm also in opinion that when the hardship is over or anxiety provoking situations are over, we need to reevaluate. And if they are taking any medication, we need to discontinue or taper it down to see that when the body can heal itself. We need to let the body heal itself. So I think that's the problem, that people have, the physicians or the nurse practitioners have no time to evaluate that if I gave this individual a medication for anxiety for 6 weeks, I need to reevaluate whether the stressful situation has abated so that we can try to decrease the medication. So we need to give a chance to everybody that they can live without medication.
Right.
And in fact, I said to everybody and anybody who takes medication more than 6 weeks, any medication, they need to reevaluate. Suppose somebody is taking medicine for diabetes. You know that diabetes can be treated without medication, right? That
Yes.
if you put the food habits, you lose your weight and you do right thing, after a while you don't need that diabetic medication. So
Mhm.
similarly, hypertension, similarly coronary artery disease, or cholesterol lower medication. All these needs to be reassessed. Any chronic medicine people are taking, that can be reassessed time to time. But the people are not willing to do the hard work. People want quick fixes, and especially the newer, younger generation, they don't want any hardship. And I think the societal expectation and human expectation has changed. If you look at the old times, not sleeping a night is not a big deal. Okay, you sleep the next day, or having some stressful situation, you go to your uncle or you go to your brother, you talk to them, and they listen to you, they console you, and you go to the teacher or the priest, it's over. But now there is no society. You can't go to anybody. You don't know your neighbor, you don't have a extended family. So what do? You need somebody. So you go to a therapist, and that becomes a mental illness. So the society is changing and our expectations are changing. But I would
Yeah.
urge this podcast that anybody, any medication you take it for more than 6 weeks or 8 weeks, you need to reevaluate that what other way you can let your body heal without having these medications.
Boy, I love that. I love that comment. And I know Dr. Murphy, you're sitting there smiling too. You probably love it as well. Um, yes, absolutely. Just a little reminder to our audience, any of the information given here is strictly for educational purposes. If you have questions or you are considering something, dropping your medications, or please seek help with your medical professional of whom that may be. So this is not meant for medical advice, this show. So, Dr. Oxer, psychiatric medications influence with brain and nervous system networks. However, these medications do not simply replace a substance that has been proven to be missing. Maybe with lithium, perhaps. It all depends. Their mechanisms may involve receptors and neural circuits, stress responses, sleep attention, arousal, and gradual changes in brain network functioning. Their intended therapeutic outcomes may include reduced symptoms, improving daily function, and as Dr. Akhter said, perhaps reevaluation. You can figure out what you need to do to maybe compensate for certain things in your life other than medication or in conjunction with medication. So, Dr. Akhter, do psychiatric medications treat an underlying disease? I think you already answered that. Not necessarily is what I got out of it. Am I correct?
It does treats serious mental illnesses
Okay.
like schizophrenia, psychosis, bipolar illness, mania, or some depression. But majority of the anxiety and depressive illness, or these can be addressed in other form too. So my approach is, until the person learns to cope or do other things to ameliorate their symptoms, I would like to give them some temporary relief, but
Right.
not a permanent solution. That pills are not the permanent solution for emotional distress or emotional illness.
Fantastic approach. Could you just fill us in briefly, like the different medication categories and their purpose? The
So,
purposes?
so basically, that the one of the thing which I believe that works fantastically in psychotic illnesses. people with psychotic illnesses. And psychosis is generally simply that a it is a generic descriptive English term that when an individual is detached from the reality, that is psychosis. So whatever is the situation, right? Some people have very stressful uh, time. They lost their job, their wives are divorced them, or their husband left them, and their children are not doing well. They're under huge pressure, and they have nervous breakdown, right? So that also a form of psychosis. Somebody is predisposed to some major mental illnesses like schizophrenia. They got detached from the reality. They are hearing voices, but nobody is there, or they are thinking that people are after them and are trying to hurt them, right? So in those situations, antipsychotic works. And again, in this situation also, if I go through a very stressful situation and I have a low threshold, and or somebody I know whose husband left home, she doesn't have money, kids are not doing well, and there are huge stress, and she cracks up, goes to the hospital, and we give her antipsychotic, she gets better. But at this point, I need to see whether can I remove this medication or not. But
Right.
which is lacking right now in our society, that nobody is reevaluating whether they can live. That was a temporary glitch in the system, or this is a permanent glitch in the system. So that what I would say to every psychiatrist and every nurse practitioner or anybody who's prescribing medicine, please reevaluate whether are you over medicating your patient or you are unnecessarily medicating your patient.
Mhm. I
Symptomatic really important, but addressing the core value is also very important. And I give you
mhm.
an example for everybody who is a listener, that suppose we have fever. So we gave Tylenol for fever, right? Fever medication for fever. But we try to find out whether this is a viral fever, bacterial fever, fungal fever, cancer fever, or what fever it is, right? But if you can't, you keep treating fever all these lives unless you know the reason. If somebody has bacterial infection, you give antibiotic. So this is lacking in psychiatry right now. If somebody is anxious, why they're anxious? A psychotic patient can come with anxiety. A manic patient can come with anxiety. A depressed patient can come with anxiety. Anxious patient come with anxiety. But you need to figure out that why patient is anxious. Okay, I'm not saying don't treat the anxiety, but at the end of the day, we have to find why the patient is anxious. So
In other
this
words,
is
don't
lacking
just
in
prescribe.
psychiatry.
Right.
Yes, giving
I
medication.
love that.
So patients are getting better and they think, okay, now my problem is solved. But if the doctor doesn't tell them that, hey, that was a temporary phase, let's reevaluate what you need to do in your life, that you're not dependent on this medication.
Mhm. That's fantastic. I hope all psychiatrists actually go by that um, system, because I always think I'm a minimalist. I always think that less is best, but maybe not in every situation, of course. But I like that you take a very cautious approach. Dr. Murphy and Dr. Octor, is treatment with several medications more effective than treatment with one?
We can get into that with Dr. Octor, I think, in detail in a minute or two, but I just wanted to throw in something. As a
Mhm.
psychologist whose job was to oversee mental health care in correctional institutions, jails and prisons, we can talk about the differences in those two settings, and we're going to have to stop and take a break in a second. But when we come back, we can really talk about, where we find um, some circumstances in which mental illness is extremely rare and some in which it's much more common. And we'll be back in a moment
Yes.
to talk about that.
We'll be right back.
Master of words, powerful player. What life-changing words can Dr. Janet Smith Warfield pull out of her magical toolbox that just might mysteriously open a door you never knew was there? A door to free yourself from fear forever. Transform your rage into right action. Release your guilt. Position you into a life of freedom, purpose, passion, power, and peace, all quite suddenly, unexpectedly, and almost miraculously, with no effort on your part. Join Dr. Janet on Dancing with Words, Dancing with Wisdom, as she and her guests show you how words map our experiences, immersing you in a sound bath that relaxes your muscles, opens your mind, and supports you in co-creating your extraordinary life. Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness: Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals.
Welcome back to Holistic Psychology with Dr. Michael Murphy and his special guest, Afak Akhtar. And I'm just letting you know, please like, share, and subscribe so we can keep these shows coming. This is very important information for society today, and we're trying to get this out to you. Like, share, and subscribe. We've explored how psychiatric medications affect the brain and why more medication doesn't necessarily mean better. We'll now consider alternative treatments, substance use, diagnostic confusion. You know, Dr. Murphy, what do you say about that?
Well, one of the things that I think is a real interesting point now is that we're seeing a lot of changes in our society. In terms of the public and how mental health care is provided, the issue of homelessness, the issue of substance abuse, and how all those interact to create, circumstances in our community that are really becoming more and more problematic. So one of the things that I have done in the past is be chief of mental health for various jails and prisons and correctional institutions. And people would come in and they would be very, very unstable when they come into the correctional environment. Of course, they're unhappy. They've been arrested, they've been detained, they've gone through some kind of legal proceeding, and now they're being held in a jail or facility. And they previously probably have been taking, almost without exception, some combination of substances, maybe illicit substances such as opioids or cocaine or lots of alcohol, marijuana, other drugs like that in combination with each other. So when they come in, they're very uncomfortable. They're detoxing from those substances. And then over time, though, they do successfully complete a detox and their mental state increases to the point where, in my experience, the rates of the presence of the active symptoms of a mental illness in jails and prisons, if they're well managed, are extremely low. It's extremely rare, certainly less than 5%, usually less even than 2 or 3%. So it seems like after a person who is abusing a whole number of substances and is demonstrating psychiatric symptoms, even of psychosis, after a period of time when they're able to detox, eat regular food, cleanse themselves, they actually are able to recompensate and maintain a sense of a well-ordered mental state. So I see that, and I've seen that repeatedly in correctional institutions, that really indicates that lifestyle has a very powerful effect on the presence or absence of psychiatric symptoms. We talked earlier, and Dr. Akhtar talked earlier about neurosis and psychosis. I'm old enough to remember when, people would get involved in psychoanalytic psychotherapy, Sigmund Freud and all that. where you would get involved in therapy 3 to 5 times a week for 3 to 5 years. So that's the kind of investment that people would make in those days in psychotherapy in order to address symptoms of depression, symptoms of unhappiness, symptoms of alienation and loneliness. And so it really is something that we no longer invest that way in psychotherapy. And we're going to talk about that because psychotherapy is a powerful healing tool if it's used in the way that it really needs to be used in order to really um, improve and in many cases heal completely, the active symptoms of a major mental illness.
So, could you explain the difference between psychotherapy, cognitive behavioral therapy, group therapy, and perhaps others as well that you run across on a daily basis?
Yeah, people, when they enter and seek treatment, one of the first things that we do is to ask them what's going on. So taking a comprehensive sort of assessment of their personal historical background, and also seeking to understand what they feel is really of concern to them now at the current time, what's causing them to be unhappy in the current time. So, so the purpose is to give people a sense that somebody else understands them. That's empathy. It's the sense that another human being really is accurately understanding their human situation and is able to reflect to them that they are really being heard and understood. That's a caring message that in and of itself can really be healing. And that's one of the most powerful tools in psychotherapy is the sense of being heard, the sense of being understood by another human being. As Dr. Octor was saying before, those um, services, if you will, or those relationships used to be offered oftentimes by family members or the parish priest, other people who were involved with the individual themselves. And so the process of psychotherapy and the regularity and commitment to psychotherapy can really make a huge difference because that in and of itself, just the feeling of being understood and heard by another human being can in and of itself be really ameliorative and healing for the person. So, and that happens, believe it or not, in jails and prisons as well as psychiatric hospitals, where people really do have the chance to be safe and to be protected, and their lives are more structuralized again, so they can sort of get themselves together, so that the rates of illness, the active symptoms of an illness, will really significantly decrease.
Okay, we're going to skip down because I have these questions for Dr. Octor and you, Dr. Murphy. So, by all means, you guys key in as you choose. And I just want to get these questions in. Is physical dependence on medication the same as an addiction? I think that
So
one's
for
for
any
you, Dr.
substance, for any substance, whether it's prescribed or a street substance, um, they both have both components, a psychological addiction and a physical addiction. So as far as the physical addiction is concerned, there are medication to addiction. It takes time. As Dr. Murphy said, that commitment to psychotherapy, how I do it in a different way. What I look at it as the take an example of suppose somebody has fracture of femur. So what you first do surgery, then you after that they heal, then they go and take a crutch, they walk with the crutch, and then after that they have some strength and they walk without it. Similarly, when there is emotional distress or you damage your neurons or your brain through drugs or whatever it is, or your inherently chemical imbalance, you take medication to subside those. But after that, so suppose from the fracture, patient, fracture of the femur patient, he doesn't work on his muscle strength. He can never walk properly. So he goes to the gym, he goes to the physical therapy, works strenuously, and his strength is back. But this work, bringing back the emotional strength, was the job of psychologists, which has disappeared. And the people are, you know, looking for instant gratification. So they're not looking to strengthen that, rather than they're taking the pill and not letting their body to heal properly. So that's the
Hmm.
one gap I can see, that the psychotherapeutic intervention is lacking in psychiatry. Whatever is the reason, production of psychologists, availability of psychologists, or the demand of psychologists is too high. If you today in America, you cannot find a psychologist, a PhD or PsyD whom you can go and talk to or get some psychotherapy. You can't find it. Nobody has spots, or they don't enough psychology.
That's a great observation, and something I wanted to point out is that you mentioned earlier cognitive behavioral treatment, and that
Hmm.
really is what that is. I mean, cognitive behavioral treatment is the process of meeting with a person, and in the course of those meetings, helping that person to come up with a strategy for engaging the problems that they have and coming up with solutions that will allow them to feel like they're able to function productively again. And one of the most powerful tools for improving a person's self esteem psychologically is when they accomplish something that they believe is difficult. So, when you have a psychological or emotional problem, you go to therapy, you participate in cognitive behavioral treatment, you complete work tasks like meditation or exercise, positive visualization. You do the kind of tasks that you complete in cognitive behavioral treatment, and you realize that you feel better and you've done that work yourself. So that actually improves your self-esteem, the sense that you are a powerful person and that you can solve your problems. And that in itself really improves mood very significantly for many people.
That that just rings bells on my end so often. When I was in the doctoral program, I was a caregiver for two different people here in my home, and it was 24/7. I had no real help back then. And I did the doctoral program as a fight or flight thing within my own self. My id just was crying out that I had to accomplish something for myself to take to the future rather than making all my time about them. So when I actually achieved that, it just gave me so much more inner power. It helped pull me out of a semi depressive state as well. And I think just going forward into the future, looking forward, I mean, that worked for me, but I know that the combination of the two of you together for patients, like, I mean, that's what you were kind of hinting on there. When you work with a psychiatrist and a psychiatrist works with the psychologist, it can be amazing, especially with good notes and everything else. Um, I'm just grateful that this type of partnership between these two fields actually do work together, as long as, now I'm sure some of them don't sometimes, depending on the person and who they're dealing with. But can you add anything to that, the partnership?
Oh, I think integrated treatment is just the most powerful, as you say, when you have the medical part, the psychiatric end, treatment with medication, and also the psychotherapeutic part where people are learning skills that they can apply in their own life, that they actually see make a difference. So you're
Mhm.
addressing the whole spectrum of vulnerabilities and needs that the person has. And it really is a fantastic opportunity to get better and see a big difference. And I had the honor of sharing that with Dr. Akhter over a number of years. And we'll be
Yeah.
talking about that
So
when we come
we
back.
are going to take a third commercial break, and when we return to our final segment, we'll discuss individual liberties, family participation, and the difficult question of when a person's right to refuse treatment may conflict with safety. We'll be right back.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of the Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on the Caring Generation and PamelaDWilson.com.
Master of words, powerful player. What life-changing words can Dr. Janet Smith Warfield pull out of her magical toolbox that just might mysteriously open a door you never knew was there? A door to free yourself from fear forever. Transform your rage into right action. Release your guilt. Position you into a life of freedom, purpose, passion, power, and peace. All quite suddenly, unexpectedly, and almost miraculously, with no effort on your part. Join Dr. Janet on Dancing with Words, Dancing with Wisdom, as she and her guests show you how words map our experiences, immersing you in a sound bath that relaxes your muscles, opens your mind, and supports you in co-creating your extraordinary life.
Welcome back to our show. Today we examine psychiatric treatment from medical, psychological, and a human perspective. Now let's discuss the role of families and, your rights as a patient. Can you refuse medication? I mean, these are things we're going to discuss in this, so don't, key out. You're going to want to hear these things. So let's discuss about what are some of the things, Dr. Murphy, that the family can do, and we'll also get Dr. Akhter to key in on this as far as family involvement and with the patient at home. What are the warning signs, and providing accurate history, things they can do. What do you say?
Yeah, I actually specialized in family therapy treatment, and because it's such a powerful modality to have family members be involved with the patient in the process of treatment and even meeting with the entire family at the same time. It's called family therapy. It's extremely powerful. It's like it's a form of personal group therapy that really can be effective in helping the person's environment to be more supportive for them in ways that are really effective. So it's just, that's the deal. When you can get the whole family into a room where you really can talk about the history of the situation and how it affected the person, and everyone can contribute their sense of understanding of what's going on with the person. People who have been with them throughout their lives, you have access to information that's really precious in terms of understanding the situation. And as we all know, the key to helping someone well is understanding their situation accurately. So the family involvement is just a very, very, very important thing. And I've seen the results many times if the family's willing to come in and share the journey of recovery with their family member.
And Dr. Akhter, from your standpoint, what are some of the early warning signs the family can, observe in the home to kind of signal it's time to go and see the psychiatrist?
Basically, usually it starts during the teenage years, like in high school. Children get a little bit independent, and at that point, they start setting up the anxiety, being popular in the class, having a prom, having a date, and girlfriend, all that. So that sets anxiety, and at that point, the parents should be available. And if they are not available, then the kids either seek drugs, and then that complicates the situation. So being more involved with teenagers, they try to throw you out of their rooms, or don't come to my room, don't talk to me. but that's their age, and I think we still need to keep an eye. The warning signs are, I would say, that falling grades, absconding from
Mm.
school, locking up in the room for too long, not sleeping properly, uh, and spending too much time in the computer, internet, Facebook, Instagram, and so on and so forth. Um, that could be alarming signs. So having a constant check on your children is the important thing, that where they are. A lot of serious mental illnesses starts during that age, 17, 18, 19, 20. So you will see a lot of illnesses come out when the kids go to college, because college is very anxiety provoking. They first time they're living by their own, they're having their own independence, they have a lot of exposure suddenly. So that could be overwhelming. So with all the parents, I think they should check on their children when they are in dorms, often, not only the phone, they should go visit them and meet them so that you have a first-hand assessment what is going on there.
Meeting their friends too, I bet.
Yeah.
so
Yeah.
so in short, being there for them, supporting them, communicating with them calmly, respecting their dignity and autonomy. Dr. Murphy, this is where you need to pitch in here. How else can families participate without becoming controlling, punitive, or intrusive?
Well, I think as Dr. Octor was saying, I mean, it's complex and challenging to grow up in this society and to learn to become independent. And that's what childhood and adolescence are really about. I mean, they're about the person going from a person who needs others in order to survive on a basic biological level to being a person who has the capacity to find a way to take care of themselves physically, emotionally, financially. These are big challenges. And so it's normal for adolescents and young people to be anxious about that challenge and the nature of that challenge. So family members really need to be keyed in and be attentive to them and ask them how they're doing. Share conversations, share experiences, go on recreational activities together. I mean, the key is to spend time with each other, to have quality relationships. What is quality time? We talk about quality time. Well, quality time is when you give a person all of your attention. So that's what quality time is. And it's surprisingly rare when most of us in our harried lives, where we're very busy, have the capacity to give a person, whether it's a spouse or a child or a neighbor or a friend, our full attention for some period of time, whether it's 5 minutes or an hour or a day, to really be able to be there with them in a way that says to them, I'm completely focused on you. And you're the only thing that matters to me right now. And when a person feels that, that's very healing for them. So that's how the family can really be involved. And it's just tremendously powerful healing relationship.
Wonderful. Dr. Octor, does the family or the person themselves have the right to deny medication?
Uh, yes, they do. If somebody is in a solid frame of mind, they can deny medication. But there is
Thank you.
a condition when the individual is not, cannot make a decision. Suppose somebody is psychotic, think that FBI is following them and there are transmitters put in their houses. They are detached from the reality, so they cannot make the decision. Or if somebody has a infection of the brain and they don't know where they are, what they are doing, they cannot make the decision. But majority,
Right.
Yeah,
the individual
You know,
in a solid
yeah.
mind can deny medication.
so I just want to thank you for coming, Dr. Octor, and of course, Dr. Murphy. We love what you're doing with the show. And I want to invite everybody to come back next week or in 2 weeks for another show on the holistic psychology of Dr. Murphy. May we continue to seek treatment that is scientifically responsible, ethically grounded, and centered on the whole human being. Until next time, thank you very much.
Thank you. Thank you,
Thank
Dr.
you
Murphy.
so much.
This has been Holistic Psychology with Dr. Michael Murphy. This program is provided for educational purposes only and is not intended to diagnose, treat, or replace the advice of licensed mental health professionals. Always consult a qualified provider regarding your individual needs. If you are experiencing a mental health crisis, call 911 or seek immediate emergency assistance. This is Holistic Psychology with Dr. Michael Murphy. Interviewed by Dr. Gloria Warren.